hand function. But I will sort of move swiftly on, and we are recording, aren't we, Joe? Yeah, correct.
We are now.
I will welcome Dr. Krishna Yeshwarath, who is one of our staff governors for NHFT, but he also runs Carers Corner, and Dawn Hunter from Northamptonshire Carers. So I will hand over to Krishna for his presentation.
Thank you very much, Tracy. So my name is Krishna. I'm a consultant psychiatrist. I currently based in St. Mary's Hospital. Before I was based in Berrywood Hospital. I worked in Berrywood for around 6 years on the wards, and then I moved over to St. Mary's Hospital. I've been an inpatient psychiatrist, and most of my experience comes from working on the wards. And in Berrywood, I was mainly on the male ward, so I've seen a lot of most of my clients were male patients with serious mental illness like psychosis, schizophrenia, bipolar disorder, and also depression, anxiety, personality disorder, and all of that. Okay, so thanks for this opportunity. So I've prepared a small PowerPoint presentation, which I'm going to upload now, and I'll make a start soon. Okay, I think it's come up. Can people see it?
Yeah, we can.
Okay, fantastic. So before I start, I just want to clarify that when I refer to carers, I'm basically referring to unpaid carers, which are family and friends who are looking after their loved ones. Okay, so who is a carer? For me, the problem starts right in the beginning over here, because a lot of carers don't even realize that they are carers. They do a lot for their loved ones, but they don't recognize themselves as carers. I think there's a slight misconception when it comes to the understanding of the word carer, because a lot of people think that you're a carer only if you're physically supporting someone, like, you know, helping them to take a shower, change clothes, or whatever. But that's not the case, actually. You are a carer if you provide any form of support. It doesn't have to be just physical. It can be emotional, psychological, moral, financial, giving company to someone, anything. So there are a lot of carers out there who don't see themselves or who don't know that they are carers, especially parents. I repeatedly have these conversations, like especially moms. Moms say, I'm not a carer, I'm their mom. That's what moms do. And that is true. But I think what's important to realize is that at the end of the day, it does takes its toll on you. It is a very demanding role, and therefore there's no harm in taking some support. But yeah, there are a lot of carers out there. How many of them? It's very difficult to say, but there's a rough estimate that there are probably around 10 million unpaid carers in the UK, which is a lot, you know, maybe 1 in 6 or 7 in the population. How much money do carers save the NHS every year? I was very surprised when I got the answer to this question. It's actually around 160 billion pounds every year. And that is roughly the entire budget for the NHS, annual budget. So carers are actually saving so much money. Otherwise, the NHS would have to double its budget if not for the carers. So this just shows the immense contribution of carers, and the NHS would really struggle without what carers are doing. So Carers Act was passed by Parliament in 2004 to formalize rights for carers. Again, some people may never have heard of the Carers Act, but basically carers now have a legal right. They have a legal right for a carer's assessment. The carer's assessment will look at what are their needs and how the role of a carer has an impact on them. Like, for example, as a carer, you may not have time to do a full-time job. So you may be forced to take a part-time job, or even may be forced to give up your job completely. You may not have opportunities to go into higher education if you would like. You may not have time or the finances to have time for your leisure activities, for your hobbies and all that. According to the Carers Act, the local authority have a obligation and a responsibility to look into this and to help you as much as possible so that you can also have your employment, you can enjoy your hobbies, have a good work-life balance. So I think it's important that carers have a carers assessment and then accept whatever support they can receive from the local authorities. Now, there is ample evidence that working with carers and families is not only beneficial for short-term outcomes, but also leads to long-lasting improvements in the mental health, function, and quality of life of those with mental disorders. So basically, this says that people with mental health problems, their recovery chances is much better if professionals work with families. Now, for me, as a consultant psychiatrist, the most important goal for me is the complete or successful recovery of my patient. And clearly, there is enough evidence that working with the carers, involving the families, giving them a role in the care planning and everything actually improves the success and the recovery outcomes. So for me, this is a very, very big reason why it's important to involve carers and families, because we have much better chances of success and our patients have a much better chances of recovery. Now, NHFT has a carers charter. A carers charter basically is a commitment from NHFT that they will support carers, that they will prioritize carers, and that they will put things in place so that carers are supported, involved, and have a forum and opportunity to raise their concerns, raise their voice, and contribute to their loved ones, and also be involved in the trust with regards to his processes and meetings and all of that. So NHFT has a carers charter which is available on the website, and NHFT also has a common sense confidentiality. Most of you may be aware of this, but I'll briefly describe it. Confidentiality, as you know, is very important to us, and we prioritize confidentiality, and all patients have a right to their own confidentiality. But fortunately, most of my patients do not object when we want to involve family and parents or loved ones, partners into their care planning. They don't object. Sorry about that. Occasionally, they do. Occasionally, they don't want families to be involved. Occasionally, they don't want us to give any information to the families. This could be for various reasons, but mostly I've seen it's when they're a bit paranoid, when they're very mentally unwell, and they're not able to trust anyone. In these situations, obviously, we find it very difficult to share information with families, but that doesn't mean that confidentiality becomes a barrier between professionals and families. We can still listen to the families. We can still take their opinion. We can still take information from the families. And we can still offer them reassurance that their loved one is okay, they are safe in hospital, they're getting better with treatment. But we cannot give the details because we don't have the consent. But as soon as we get the consent, we can get them involved and we can give them the details. But as of now, we can't, but we are here to listen to them. We are here to support them, and they can tell us what they feel that we need to do to support their loved ones, especially when they come out of hospital and all of that. So this is common sense confidentiality. All staff in NHFT are trained in this, and hopefully this is working well. So why was Carers Corner started? I saw in my role as a consultant psychiatrist, I come across lots and lots of carers. And I found something that was very common. A few things that was commonly shared among carers, and I'm going to put that out there. So carers felt isolated and unsupported. Carers had little to no knowledge of mental illness, tendency to blame themselves for the mental illness of their loved ones, and to feel very guilty. So this is quite, again, a tendency amongst parents. They reflect about the childhood and they say, oh, maybe I made a mistake, I should have done something different, going on reflecting on the childhood and trying to blame themselves because they feel that they are the cause. So I had to frequently intervene and tell the parents, no, it's not your fault. You're not to be blamed for your children having psychosis. In fact, we don't even know exactly what causes psychosis, but we do know that there are certain factors that contribute to psychosis. And there are so many different factors. So it's not just one or two. So it's not your fault. Please don't blame yourself. Carers were unaware of their rights and also of the support networks available to carers. Like, for example, most of them had not even heard of Northamptonshire Carers. And Northamptonshire Carers do a fantastic job supporting carers in the community. But they didn't even know about it. And there was a real gap in the services as far as support for carers was concerned. Our treatment was geared towards our patients and putting in everything to support our patients. But what was there for carers? We are expecting our carers to look after the patients when they go home, but there is no support for carers. There is no information given to carers. Carers didn't know where to turn when they were in crisis. So we realized that there was a real gap out there. And in order to plug this gap, we started Carers Corner. So we started Carers Corner in April 2019. So this was roughly around 4 years ago. I started the group with the help of Amy Stanley, who was the co-ward matron at that time. Amy also had the same concerns. We had the same approach and thinking that we needed to do something desperately for carers. And I could not have done it without her help. And it was great that I had someone with the same thinking. So we started it as face-to-face at Berrywood Hospital in Northampton. But later on, after a year, due to the pandemic, we moved online to Teams. We started it as every alternate Thursday morning fortnightly group for 2 to 3 hours from 10 a.m. to lunchtime. And in October 2021, we started monthly evening groups in addition to the daytime groups, following a request from working carers. Because there were so many working carers who could not attend the morning groups due to employment. So we thought we'll start an evening group. And there's been a good response to that. This is online. We start at 7:30 in the evening, first Wednesday evening of every month, starting at 7:30, going on till 9:30, roughly. And carers who can't come in the mornings, they tend to come to this evening group. So in December 2022, Carers Corner won the Engagement and Involvement Award at our local ceremony. So this was very pleasing for us, and this was a reinforcement for us that Carers Corner has been successful in engaging and helping carers. And we were really encouraged by this award, and we decided to make it a weekly session so that we could reach out to more carers. We also went back to doing face-to-face because even though Teams worked out reasonably well, it didn't have the same quality as doing it face-to-face. I think the connections when you do face-to-face is much stronger. And carers also have an opportunity to do some networking when you're doing it face-to-face, which is very difficult online. So we've gone back to face-to-face now, but some carers still wanted to have the option of joining online due to transport issues. So they still have the option of joining online as well. So we now alternate every Thursday between Berrywood and Northampton. So one Thursday in Berrywood and one Thursday in St. Mary's Hospital in Kettering. So again, we've expanded it to the whole of the trust. So previously it was only in the south in Northampton, but now we have opened it to the north as well. So people can come from Corby, for example, they can come to the one in Kettering, and people who live in Daventry can come to the one in Northampton. So we made it weekly and expanded to both sides of the county. So how does it work? So Carers Corner is co-produced with staff, carers and peer support workers. Sorry about that. So it is, we've got yes. So I'm supported by Sharon Gibbard, who is a carer expert by experience. So Sharon has been supporting us from day one as well. Her son has a mental illness, psychosis. Unfortunately, Sharon has not been able to be here today. But we've got, I think, a couple of other carers who also attend Carers Corner. Janice Anderson, who's from the enrollment team, Rachel Whitney from the Berrywood Hospital, head of Berrywood Hospital. Trina Inwood is from Northamptonshire Carers. So it's good that we are collaborating with Northamptonshire Carers. Got a couple of carer peer support workers as well. So carer peer support workers, as you know, is a relatively new project, but they are working with us and recruiting carers to our group. And I sometimes refer our carers to them as well. So we are working very well together. So how does the group work? So basically, the first hour, each carer shares their experiences and emotions of the previous week. We listen and support each other and try to come up with any suggestions if we can. So basically, this is a safe space for carers to, to speak, to vent. If you're feeling frustrated, helpless, desperate, we are here to listen to you. We are here to support you. And we try to come up with suggestions because some carers have a lot of experience. They've been through the whole journey in the trust. So they come up with some very good suggestions as well. In the second hour, we have an educational session where we talk about what are the causes, symptoms, and treatment of mental disorders. I have prepared a PowerPoint presentation. It's got around 50 slides. So I cover various aspects of mental illness, like causes, what is the symptoms of mental illness, what to watch out for, what is the treatment, talk in detail about medications like antipsychotics, mood stabilizers, antidepressants. Also talk about what carers can do to support their loved ones, what they should try and avoid, where to reach out for help, what to do in times of crisis, what is the meaning of different professionals like psychiatrists, psychologists, CPN, social workers, what is their roles, what is the meaning of Section 2, Section 3, all of that. So we give as much information as possible about different aspects of mental illness and treatment. And sometimes we invite external speakers as well, so that they can come and talk to us about their role. So we invite social workers, CPNs, and all of those. So referrals are welcome to Carers Corner. The feedback we've received is very, very positive. Carers feel very supported. They feel that this is a good forum for their voices to be heard. It's a safe space for them to express themselves. And they also support each other emotionally, and they try to come up with practical tips and suggestions from their own personal experiences. So we are always open to carers, and we are trying to publicize the group as much as possible. And I think Carers Week is a good opportunity to publicize Carers Corner as well. And we are working with the comms at the trust to try and give our group more publicity. So the only criteria to join the group is that the carer must have supported a patient who's currently receiving treatment or has received treatment in the past from NHFT or any secondary care for a mental disorder. So basically, we've not opened it up to primary care yet. We've just kept it more exclusive to secondary services. But yes, anyone who's gone through secondary services, NHFT, or anyone with a mental disorder, any carer like that can be referred to us. And we'll send them the information about the group, our leaflet, our aims and objectives, and all the information, whether they can come online or in person. So all you have to do if you make a referral is send the email to carerscorner@nhft.nhs.uk with the carer's number, name and phone number, and we'll sort out the rest. So thank you for listening. I finished my presentation, and I hope you enjoyed it. And I'm open to any questions or comments.
Is there any immediate questions for Krishna, or shall we take questions at the end? Any raised hands at the moment? So Krishna did mention Sharon, who unfortunately couldn't make it today. We do have a video from Sharon, which I believe she talks about Carers Corner, a bit about her work with Northamptonshire Carers and the Recovery College. So I'm just going to share that now. Just bear with me a second before we will then move on to Dawn's presentation. Oh, sorry, I don't think I shared the sound, so just bear with me.
Hello, everybody. So I'm Sharon. I'm really sorry I can't be there with you in person today, but thank you for the opportunity I'm able to speak to you like this. I'm a family carer member for an adult who has complex mental health difficulties, and I've been a carer for him for over 10 years now. I didn't even realise at first I was a carer. I was just a family member and just going along until I realised that actually what we were doing was far, far above what a lot of our friends and neighbours were contributing towards their loved ones' well-being. And it kind of clicked that maybe I needed some support for me as well, and to find out what was out there in a carer sense. So because I've been involved for so long, I was given an opportunity with NHFT, our trust, our Northamptonshire Health Foundation Trust, to become what's called an involvee. That meant that I could use my lived experience as a carer to try and make things better for other carers like ourselves out in the community and going through difficult times and crisis with their loved ones. This was great for me because they supported me to be able to share my story safely and confidently, hopefully, just to try and change things a little bit for people in the future, and to be very honest about what support it was that I'd needed to help me to recover as well, and to help me to cope with the day-to-day things, and also to be able to enjoy being a carer. At the time I was a bit bogged down in everything and didn't really, I felt a bit overwhelmed, which I think many of us do at times with the care and responsibilities. So as well as raising awareness of carers throughout NHFT Trust within adult mental health services, this also enabled me to become a peer trainer in our Recovery College, which is what we're celebrating today, that union between NHFT and the Recovery College and what we can offer for carers. And so I became involved in co-producing courses along with staff members and our third sector agencies as well. And co-production means working as an equal. So whatever staff or members of North Hampshire carers or whoever we work with, we work together as a team. And I'm valued for my lived experience, and I value them for their professional experience as well. And it works really well because we've got that balance of what's really happening alongside the skills and the knowledge of what's out there and what we can hope to find to help us. So yeah, raising awareness of carers for all and ensuring that we're looking to include and involve our carers in everything. So when the lovely Northamptonshire carers joined with the Recovery College, during the pandemic, it was decided that let's do something online because, as you know, a lot of us weren't able to get out. We had our loved ones with us a lot more. Everything was face to face. Everybody was isolated. And I know that many of us are still feeling the strain of that, even though we've come out the other end as such. We're still carrying a lot of difficulties from that period that may have added to what we were struggling with before as well as all the positive things alongside. So the e-learning course with North Hampshire Carers allowed us to produce the course that we're promoting today. 3 courses in total around our health, around our well-being, around what's out there for us, around how we feel and that we're not on our own. And it's okay to feel sometimes the way we feel, and also to enable hope and actually, you know, there are things out there, there are people, there are support systems that can help you so that you can begin to enjoy your caring or enjoy it more. So yeah, that's been a really lovely time for me working alongside North Hampshire Carers, and I really appreciate that we've been able to do this together, and fantastic resources as well from North Hampshire Carers, as you all know, and they'll explain more, I'm sure, this morning. So alongside that, I also co-facilitate a carers group, which is called Carers Corner. This group is specifically for people that are caring for those with mental health difficulties. It's a safe space, somewhere where you can come and be yourself. It's completely confidential. I co-facilitate with Dr. Krishna Yatharaj, who you may have heard of, and if you haven't, please, you need to, because he's a lovely man with a real heart for carers, and he's there to support carers, to offer his expertise in the adult mental health field, and to help us navigate services, which can be really difficult, as I'm sure you know. Whatever your loved ones' difficulties are, it can be really difficult to access what they need, or even to know what's out there or how to go about it. So yeah, Carers Corner is open to everyone supporting somebody with a mental health difficulty, similar to North Hampshire Carers Calm Group, but maybe a little bit more for those in crisis. And of course, we do have a psychiatrist there, and also psychologist, and a North Hampshire Carers representative as well, to offer all-round support for people going through that difficult time with their loved ones. So through co-facilitating all this and getting involved with all this, for me personally, I feel really valued. I've learned so much. These brilliant courses that we've got that I really hope that you'll all be able to plug into and enjoy, as well as an upcoming one at the Recovery College that will be face-to-face with Dr. Krishna and myself and a carer peer support worker. Please keep your eyes and ears out for that, because we'd love to see you there. So yeah, I think anything that can support carers, anything that can help us feel less lonely, anything that can help us own our feelings and know that that's okay on the bad days, and also feel that there's others going through this, and that actually there is support, there is financial support, there is practical support, there is emotional support, you know. And we just want to raise everyone's awareness of how resilient we are, you know, how much experience we can share, and also to be there to support one another. So I hope you have a fab morning, and really hope to meet you all soon. Take care. Bye.
So thank you for Sharon for letting us show that video. She was hoping to be here in person, but unfortunately she couldn't at quite last minute. So she allowed us to use that video, which I think was quite nice to hear from her and her experiences of the Carers Corner, and also the work with North Hampshire Carers. So I think there's a nice link actually into your presentation, Dawn. So I will now pass over to you, Dawn, for your presentation.
Thank you, Tracy. That was a really nice link, wasn't it? It's like we practiced it or something. So I'm going to share my slides. What I'm not going to do is repeat a lot of what Sharon and Krishna have already said really eloquently, and build on kind of what they've already said. So just to introduce myself, my name's Dawn and I'm the Health and Care Development Service Manager for Northamptonshire Carers. And as already mentioned, a carer is someone who looks after or helps a loved one, and it might be a friend or a neighbour. Often it just evolves, that role evolves. We don't wake up one day and say we're going to be a carer. It often just happens, and we don't always identify as a carer. So I think, Krishna put that really, really well in terms of, giving people the chance to recognise that actually I am a carer, and it's okay to say that I am. You don't have to have that label, but I think it then gives you a gateway to services and support that perhaps you didn't know was there. So who are Northamptonshire Carers? Well, we're a charity. We've been there around for just over 30 years. And we started off as a carer support group in Kettering. We've been registered as a charity now for just over 26 years. We're the lead carer service provider in the county, and we have the statutory duty to provide carers assessments. So these were mentioned earlier, and a carers assessment is it's an informal way of talking with people who are carers and looking at their needs holistically. So it's not just the practical stuff that can help them sustain a caring role, but it's also the the emotional stuff that comes with that. And we've been doing that role in line with the Care Act for around 10 years. And this is a county-wide service that we provide. One of the things that we're very mindful of is the fact that Northamptonshire as a county is actually quite rural in lots of areas. So you've got Wellingborough, Corby, Northampton that are quite densely populated. We've also got quite a lot of areas of deprivation. But actually, you've also got South Northants and some other areas that are quite rural and hard to reach. So we're very sort of aware of making sure that we reach everybody where possible. In terms of stats, Krishna mentioned some of the stats that are quite scary, but in terms of some of the stats that we have almost, actually, as of today, almost 16,000 carers registered with Northamptonshire Carers. None of our services cost anything, and it doesn't cost anything to be registered with us. And what that means is that by registering with us, that you're on our database. It might mean that you don't access anything for a very long time, or you may access services straight away. And I'll talk about some of those services in a moment. But in terms of carers, we're talking about adult carers, parent carers, and also young carers. We have around almost 1,500 actually young carers that are registered with us. And the young carer, I think we start from about 5 years old, believe it or not, up to 18, and then 18 to 25, obviously young adult carers. So every cohort of carer will come with their own challenges. So it's already been mentioned about working carers, parent carers. So we're mindful of the fact that everybody comes with their own sort of challenges and needs, if you like. What we have seen also is the number of older interdependent carers rather, where you've got one elderly considered frail person looking after another elderly frail partner. In particular, we're seeing very high numbers of dementia. And as we know, people don't live with one condition, they often live with other long-term health conditions. So somebody may be living with dementia, but they may also be living with COPD or diabetes, and that number is rising. So we are sort of responsive to that as well. We know often that people, when they present in healthcare services, a lot of their overriding needs are actually social. So if you address the medical need, the social need is one that often takes longer to unpick. The community companion service that we run, in essence, is a befriending service in the home. 90% of those people that are accessing that service look after somebody with dementia, and 70% of those carers are 65 and over. So the stats kind of speak for themselves in terms of the kinds of people that we're supporting. Recently in Northamptonshire, it became an integrated care system in July last year. And while that's there to support patients with long-term health conditions, those struggling with mental health and other areas, actually what we know is that we have to support carers. You know, people often can't sustain a situation unless there's a carer underpinning that. But we are also mindful that some people do live alone as well. We are a Carers Trust network partner. Carers Trust is a national charity and we are one of the partners. So we work alongside them, and we're also working alongside lots of other partners such as NHFT, the Integrated Care System, adult social care, and a lot of the voluntary sector as well. So that's a brief snapshot of who Northamptonshire Carers are. And underpinning everything that we do is empowerment. We're about engaging carers as an equal and expert partner. So we heard there from Sharon who told her story. I think it's worth pointing out here that actually most people that work for Northamptonshire Carers or have or are at some point in their life been a carer, including myself. So we come from a lived experience. It doesn't mean that we know it all. It doesn't mean that we share all of our experience, but we understand, you know, how difficult that can be and how challenging it can be. Everything that we do is via co-production. We work collaboratively with carers as equal partners. So we want to get their ideas, and we value their expertise in terms of, you know, what it's like to live with a long-term health condition when you're a carer, what it's like when you're trying to navigate the system. Where do you get advocacy from? So all of that is really important. It's also important that we engage with lots of other partners. You know, we have a seat on the NHF Board of Governors. We are very involved in the Carers Partnership thematic group, people advisory groups. We have our own trustee board. So we tapped into enough people to know where we need to get the right support for the carers that we're supporting. One of the challenges that I think all of us are facing at some point is accessing GP appointments or GP support. And that's because there are lots of pressures in the system. So we are we're very mindful of working alongside GPs and the primary care networks to ensure that they are carer friendly. So if you go to your GP practice, you might see on a wall that they are a bronze, a silver, or a gold accredited GP practice. And that means that they understand that carers might need a bit more support. They may need to get an appointment sooner than other patients. They may need an evening appointment, all of those things that we can't just make an assumption on for patients. So we're very tapped into making sure that we listen to people, we're you know, linked into the right people to ensure that the right support is there. This is a very busy slide, so you will be sent the slides, but I think at the heart of that slide is Northamptonshire Health and Care Partnership. So we very much tapped into a lot of the work that's happening around transformation. So you will hear the words integrated care systems, collaborative working, partnership, ICANN, ageing well, all of these things. What that means in essence is for Northamptonshire Carers, we are working in partnership as part of an integrated care model, which supports people with long-term health conditions, mental health conditions, young carers, older carers, basically everybody. And at the heart of that are the carers that we're supporting. So as part of that slide, you'll see there's a lot of stuff. And I would suggest if you need to access things to go onto our website to look at that more closely. But, you know, some of that stuff is really important, like respite. We have a holiday lodge, we have groups, we have everything that you need to sustain a caring role. But I think it's knowing where to get that and what's right for you at the right time. We're not there with an agenda, but we're there to say, look, this is all there. It's a menu of services. So access what's right, what you need at the right time. The Carers Partnership Thematic Membership, it's a group of organisations, as you can see on that slide. There's actually more than that now, but Northamptonshire Carers, it includes carer representatives and the voluntary sector and also public sector. So that's people like the NHS, NHFT, adult social care, all tapped into an agenda, if you like, a theme where we are there to support people in the right way. We are at the end of the day trying to prevent people having a crisis. We're trying to help people to plan. So a lot of the things are around prevention, but actually, unless you have all the right people involved, it doesn't mean very much to the people that it affects, like you or I. So it's important that all of these people are on the same page when it comes to what we should be doing for, our communities and where the system leads come along to inform and be informed. So we will have speakers come to these groups and say, this is what's happening with our services. On this slide is a quote from Toby Sanders, who's the Integrated Care Board Chief Executive. So he basically just talks about how important it is to have that collaborative working, because ultimately by those partners coming together, it cascades down, doesn't it, to the people that really need to access those services. And what are those services? So the carers assessments, any carer has access to a carers assessment. If you're living in Northamptonshire, we can do that for you. It's in line with the Care Act and it looks at someone's needs now, but also ongoing needs as well. So it's not just about the here and now. It's very person-centred, but it also looks at actually what can we do in the future to help you to sustain this and to keep you well. Our support line is there for advice and information and a listening ear. That's Monday to Friday. All of our referrals will come via our support line as well. So you can self-refer online. Professionals can refer into us online. You can pick up the phone and refer as well. We support long-term health conditions. It's very much a multi-layered approach. So the patient is looked after in that case in terms of if you have dementia or diabetes, you can access one of these groups or the memory hubs. But actually what that means is as a carer, you also are able to access them and you can access the same education and wellbeing support and exercise as well, which is all there as part and parcel of keeping people well for longer and keeping people independent and in their own homes for longer. One of the things that's been really successful more recently as part of the Ageing Well project, if you like, is the MDT approach. That's a multidisciplinary team. And what that means is some of you may have accessed this already, but at a surgery, you may have an appointment and ordinarily that might be 10 minutes. As part of this Ageing Well service, people have access to a 45-minute appointment. And that would be in the home, it may be online, it might even be in the practice. And within that multi-agency approach, you've got ourselves, Alzheimer's Society, a doctor or a nurse, housing, all kinds of agencies coming together to basically look at the patient. But what happens then is you also look at the carer. What we're seeing is quite a large amount of those appointments are resulting in a carer's assessment. So we do currently have a waiting list for the carer's assessments, as you would imagine, and I think it's fair to say that some of that is as a result of COVID. We are still feeling the effects of COVID, and everything that we're doing is trying to manage and help prevent a crisis. So that might be workshops for carers, one-to-one support, or the support that we have in the hospitals. It's really important to mention that we have carer support at both Kettering Hospital and Northampton Hospital. At Northampton Hospital, we also support the discharge service as well. And we do have workers based within St Mary's, Isbrook, Berrywood, just to support mental health specifically. I'm not going to go over that too much, but as you can see, Northamptonshire, quite a big county, quite spread out. And we couldn't possibly put everything on the slide that we offer. Pretty much everything is on the website, but that gives you a bit of a snapshot as to what's available. There's a lot. And I think this week it's really, really busy because it's Carers Week. So we're getting out a lot more, doing a lot of outreach work to make sure people who may not recognise themselves as carers actually that could be me, and may pick up a leaflet. So what we are good at doing is capturing some good work, you know, some good practice. Some of these quotes and go some way to sort of highlighting some of the work that we're doing. These in particular were taken from the community asset groups, and also from the memory hubs as well. So everything is about learning, isn't it? You know, if you're setting up a new service, you want to learn, you want to ask carers, what do you think? We like to evaluate everything so we know that what we're doing is right, or we learn and do it differently. And in terms of good practice, nothing is possible without the whole person approach, sharing experience, having that multi-layered approach to support. We deal with some very complex cases, and there's quite a lot of intense support that's often needed, and it's something we can deal with. But I have to say that it's definitely changed since COVID. We've seen a lot more complex cases come through. So yeah. In terms of inclusion and diversity, this is a very big focus for us. It always has been, but even more so now. We have a project under Carers Trust called Making Carers Count. And as a result of surveys through Black and Asian carers, there was a lot of work that needed to be done, not just with us, but I think across health and social care. We all know about things that happened through Black Lives Matters and the response to that. We know about the rate that, the inequalities that were happening throughout the whole time of sort of the pandemic. And we've seen videos about that. So we know around the health inequalities. What we have been given the funding to do is ensure that this is sort of filtered out into all of our services, our whole organisation. And so senior management trustees have acknowledged that we need to do more. We want to engage carers and workers with lived experience from Black and Asian backgrounds, but also other GEM, global ethnic minority groups as well. Everything that we do again is around co-production, and we're aware that there's a lot of imbalance in terms of statutory agents. So making sure that everything is available to all cohorts of people is really important. This is also important in terms of staff as well. So we have created safe space meetings and tea breaks where we can just have those conversations. They don't have to be difficult conversations, but just conversations about what's inclusive, what's diversity, and are we doing what we should be doing? We have all signed up to the Big Promise, and this is basically an opportunity for us to commit and promise to speak out and address race inequality within the workplace. What happens with that is it filters down to the carers that we're supporting, and they're cared for as well. So this extends right across the organisations, and we've all made promises and we are reviewing them as we go along. And this is our CEO, Mark, who should have been here today, but you're stuck with me today. But he's made his big promise, and we've all done this. And then, as I said, we go and we review these just to make sure that we don't just want to pledge these things. We actually want to do this. You may see quite a lot of people are using the My Name Is on their signatures. And again, this is important. We use this on our online application form, and we use this on our database that we use, and we have it on our name badges. So it's important for lots of reasons. It's about name, it's about respect, it's about culture. And again, this filters down to those that we're supporting as well. So it's there to support those carers, those patients, so everybody feels they are heard. And in terms of our hopes for that we have an ethnically representational workforce, and that we increase the confidence of the workforce. And again, that's the message that we use with partner organisations such as Social Care, NHFT, community leaders, and those who may not otherwise identify as a carer. The aim of this really is to proactively encourage diversity in our workplace. And again, this then will affect how we then support carers as well. So overall, our headlines and our ambition, that there's more growth and development to engage with more carers. And what I mean by that is there are going to be more community assets, more memory hubs, more of everything, more groups. So hopefully carers are becoming more aware of the support that's out there for them. The menu of services that we develop are very much identified around needs-based. As I said, we don't go in with our own agenda. We ask carers, what do you want? What's missing in your life? We know through lots of meetings, conversations, and all the rest of it that there is a massive gap for transport. It's the biggest thing that comes up time and time again. And we are, looking for funding to try and literally go and buy minibuses and get somebody employed as a driver. So we're listening to people. All of the integrated approaches are expanding, they are ever evolving, and a lot of the pilot work that we did is now scaling up and it becomes our business as usual. So the Ageing Well team, the health condition groups, and supporting comorbidities. So again, supporting those carers who are supporting somebody with heart failure, for example. So the scalability is very much about test and learn. We ask people what they want. Prevention and early intervention is quite high on the agenda. So the carer topic specialist is very much about making sure we are informed on what people want and what the emerging gaps are. So we know there's a gap in transport, but that's not that easy to sort of solve at the moment. But it's about looking to see what the gaps are and what can we do, or what can we speak to our partners about to try and fill that. So it's really just to summarise that a carer can be anyone at any time. A carer is an individual with their own needs. That's probably the most important thing to stress here. Northamptonshire Carers provides support for carers, young and old. Carers are legally entitled to a carer's assessment and support, and supporting carers reduces the demand on the wider health system. We've heard how much they save the NHS, and those are just the carers that we know about. So it's probably a much bigger figure than we thought. Very easy to refer to us. You can just literally pick up the phone and we're happy to sort of take your details. You can register and use services as you need to, or you can register online just using the online referral form. So it's really, really easy to do that. This page here is just some videos if you wanted to watch those in your own time, but sometimes we're not very good at showcasing what we do, are we? But these videos go a little way to show some of the things that we've got in terms of the hospital support, some of the GP work that we're doing. And also I think in particular Kirsty, she's a young adult carer now. She's been with us a long time, so she was a young carer, but now she's a young adult carer, but she's also a young carer champion. It's really lovely to watch videos like that because you can see the cause and effect of supporting people in the right way. And that's me. Thank you very much.
Thank you very much, Dawn. That was certainly an interesting presentation, and it just shows how many services you offer. It looks like there's lots of services there that I'm sure lots of people weren't aware of. So hopefully people are now aware of those services. So does anyone have any questions for either Krishna or Dawn? So you can either use the chat or raise your hands. Any questions? Got a So Susie's just put in chat, it's the first time she's heard of Carers Corner. How can we find out the dates and times? I think you said, Krishna, they're every Thursday, didn't you? At 10 o'clock.
Yeah, every Thursday morning, 10 to lunchtime. Obviously, I do have a leaflet, and the leaflet has the dates for the rest of the year and the venues as well. You know, which dates in Berrywood Hospital in Northampton, which days it's in St. Mary's in Kettering, and giving more information about our email address. So I do have a leaflet. Shall I send the leaflet to you, Tracy?
Yeah,
And
if you send that
forward.
across, we'll send it out with the slides.
Okay, I'll send my leaflet to you then, no problem.
Yeah, it looks like we've got Pat's got a hand up. So Pat, you can come in with your question.
Hi, Dr. Krishna, it's Pat here.
Hi, Pat.
I was just thinking in terms of the transport. I don't know, you may have already done this, but sometimes some of the sort of minibuses and the bus hire people, they tend to do some charity sponsors in the sense that they've got their own sort of marketing or whatever it is, and they might be able to just, help you guys out in terms of it, the kind of sponsor like a minibus kind of thing. I've done it before with other charities where they've sponsored to light up, different landmarks or whatever it is for that particular thing. So they might be willing, or you could actually approach somebody to actually sponsor that and then have them on the website with banner ads or something like that that goes directly to their website so that they're getting some benefit out of it as well. Just suggested maybe to approach them in that way. I mean, I don't know if you've done it before, where you've actually asked them to like give it to you for free out of their funding and marketing and stuff like that. They might be able to do it for you, or maybe for a certain length of time. I don't know, but it's just something to think about.
I've literally just written that down. Thank you. It's really good because there's a really good charity called Serve, and they have quite a few minibuses. So I think what we're really lucky at and what we're really good at is working with lots of partners. So there's options that we have, but I think the trouble is just not enough of minibuses. We need them all over the place. But that's a really good idea. So I've written that down. Thank you.
Yeah, some of them are national as well. I don't know. That, where they've got depots all over the place, and perhaps if you just approach them for, a small part of their funding nationally, there are some that are national that might be, inclined to sort of do it for you in that way as well.
Thank you.
Thank you, Pat. Richard, you've got a question?
Thanks, Tracy, and thanks very much indeed to our presenters. Really impressive work that's happening for carers, and great to see some of the partnerships that are in place already. I guess I had a sort of two-part question / suggestion. One was, I guess, related to how to get the message out there, because I was struck by how sort of transient the carer role could be. I accept that a lot of people are supporting people with long-term conditions too, and that point about, well, not everybody realises they're a carer, and certainly that was part of Sharon's story as well. I wonder whether there's any more that we could be doing to get the message out there about actually who might be considering themselves a carer and how to access support, thinking about these sorts of events that we run for members, but also through our NHFT comms channels. That was the first sort of question / suggestion. And the other one was, I was also thinking about whether there is any more we could be doing in working with local employers, because many people, I would imagine, that are providing caring roles are also trying to juggle work commitments as well. And I didn't know there may already be a lot of work happening with local employers, but I was thinking through our connections with the health and wellbeing boards and so forth, we are linked in with employer networks. So again, thinking, is there an opportunity for us to engage more with local employers too? Thank you.
For that, yeah. That's a really good point, Richard, about the comms. We're very much tapped into NHFT comms, so quite often I send Chantel a lot of stuff, and she puts it in the newsletter. So you might have seen quite a bit of that. in fairness, a lot of that is linked to Ageing Well and the ICANN work, because that's been, you know, a lot of that work for the ICS. But I think what's happened with that is I'll always make sure there's a bit of a spin in that story, that it does cover something around the carers. Invariably, when we're reporting on any of the stuff, it's always about the carers as well. So there is a focus on long-term health conditions, but you can't talk about that without talking about the carers, because they underpin so much of what's happening. So yeah, I totally agree that there needs to be something else, whether they're, you know, like for dementia, you have these national campaigns, don't you? I think there needs to be something more around carers. I think Carers Trust is something in the past, so that would be really good. Yeah, in terms of local employees, we don't have the people that do that for Northamptonshire Carers on this call, but we do have workers specifically where that is their role, and they engage with employees in the county. Now, in all honesty, there's not a lot of employees that signed up for it. So you've got the big people like, you know, Barclaycard or Nationwide. Nationwide are really, really forward thinking, but there's quite a few organisations that signed up to it. And I think, I don't know whether there was, I don't know what it was, whether it was a fear of, well, if we sign up to this, they're not signing up to anything necessarily, but if they understand a bit more about carers, what would that mean to us as a company or a profit-making organisation? I don't know, but I'm being cynical there, aren't I? Sorry. But yeah, I think there does need to be a bit more around employers understanding the impact of caring.
Sorry, can I just add about recognizing carers? I think as professionals, we actually do come across a lot of carers in our professional life. But I think it's up to us professionals to recognize them and to educate them about their rights, about the fact that, you know, they are eligible for their rights as a carer, that they are a carer. There is support available for them out there, and encourage them to reach out for it. So I think we can publicize about Northamptonshire carers and all of that, but many carers don't identify themselves as carers, isn't it? So it's up to professionals to kind of explain to them that, no, yes, you're a mom, you're a dad, you're a wife or a husband, but you can also be a carer. And so, you know, these things, they do have an effect, they do have an impact. And if it's important to look after your own well-being, if you look after yourself, then you can support your loved ones' well-being even better. So I think if professionals do that, I think we can raise more awareness about carers themselves. And I think the trust do some carer awareness training. I think there are some courses on the L&D website, but I'm not sure if it's part of the mandatory or training. Maybe we should make it really mandatory for all staff in the trust about carer awareness training, and this might actually improve more recognition for trainers.
Thank you.
Krishna, you've got a question?
Thanks, Tracy. I was actually going to make a comment about the employers and sort of the discussion we've really just been having with Dawn and Krishna about working carers, because for a period of time we had a system-wide group actually, which was all about, you know, what sort of standards could you maintain as an employer. If you're a good employer, what sort of standards and policies would you want to encourage within your organisation that would really support your staff's well-being? And actually, one element of that, Dawn, was support for working carers. And we had Nicola, I think, from Northamptonshire Carers was part of the group. So actually, the whole point of that was to sort of have and of course recognising around the room we had all of the big public sector employers, but what we weren't doing was sort of reaching out to the private sector. And at the time, I think we were trying to get some of these big organisations interested in actually, you know, how would you support people who, you know, who might be suffering from domestic abuse as an employee within your organisation? How would you support people who are working carers? So, and if you're a good employer and you're aspiring to be a good employer, then these are some of the things and standards you might want to do, like recognising carers and providing support. So it was a really good initiative, but it was before there was the two unitaries were established. It was Northamptonshire County Council. So obviously things changed a little bit, but it certainly did recognise that, you know, perhaps as public sector organisations, it's harder, isn't it, with a private sector organisation, but certainly if you had the police, fire, all the NHS organisations, the councils, and any other sort of big public sector employers who are probably the biggest employers in the county. If actually we all adopted really good practices for supporting working carers, for example, then that would make a difference to a substantial number of the population. So I think it's still an ambition that we should strive for, is how do we get people engaged to be good employers, supporting, because that is one route through, isn't it, is to try and through employers influence sort of policy that they have around supporting people appropriately. So I think an area for us to continue to work on, but it is something we tried to do, so I was sort of quite pleased with the progress we made at the time.
Thanks, Krishna. I've got a question from Susie in the chat asking about, I think it's the courses for learning development. I know earlier in the session the Recovery College courses were also mentioned, so I don't know if either Dawn or Krishna just want to pick up how people can access those courses.
I'm sure there is a carer awareness course. I've done it before a few years ago through the trust, but I'm not sure if it's still available. I know the department would be able to tell us about this carer awareness course. I'm sorry, I don't have the information, but obviously I can find out and get back to you on that. So I'll let you know, Tracy.
Yeah, that's fine. If you let me know, and then I can pass the information back to Susie.
Yeah, I'll do that. Regarding the Recovery College, so the Recovery College obviously do different courses, but they do an e-learning 3-part course for carers. So that can be accessed through the Recovery College. If you go on the website, you can register yourself for it. It's an e-learning course, so you can do it at your own time. So it's quite flexible that way. We are also developing a new course for carers through the Recovery College. It's not started yet, but it's taken us a few months to prepare it, but it's almost ready. So hopefully in autumn, we should be starting officially. So that's a course that we have developed, myself, Sharon, and a carer peer support worker, specifically for carers through the Recovery College. So hopefully that will be in place very soon as well.
Yes, thank you, Krishna. Do we have any sort of final questions from anybody on the call? Give people a minute, see if anyone's got any final questions. Well, I think what's struck me from listening to sort of both of you is the fact that people aren't always aware they're a carer. So it's about sort of that educating or sort of making people realise that they're actually a carer, because I'm sure a lot of people are caring for people, they just don't actually realise that. So whether that's down to the professional recognising it, or even their own friends and family outside of their immediate situation, maybe referring them to some of these services. So hopefully we can help you do that. And Krishna, I was also thinking maybe we can get our governors to help promote Carers Corner. Now you've sent me the leaflet, so we can circulate that to the other governors and hopefully get them to help promote the service as well.
Yes, so, yeah, that will be good.
Yes. And Dawn, the same for you, actually. If there's anything you wanted to sort of help circulate to our governors or even our members and our sort of member communication, do let us know and we'll help you with some of that communications, hopefully.
Lovely. Thank you, Tracy.
Well, if there's no other further questions, I would like to say a huge thank you to Krishna and Dawn for their presentations, and also to Sharon for her video, since she couldn't be here today. So I'm just going to check there's no final questions just before we conclude the session. So because I can just see a few people typing in chats, but just checking. I don't think we've got any further questions, but I'm just going to give it a second, just because I can see a couple of people typing in chat. But, nope, doesn't look like it. So in that case, thank you very much everyone for attending today. We do run other member sort of webinars. So if you didn't hear about this through being a member, I'll put the link in where you can sign up to become a member. And that way you'll find out about our future webinars, which could be on NHFT services. I think we've got one coming up on long-term conditions and sort of talking therapies coming up next month in July. So there's information about that on our website. So hopefully you've learned something from today. The recording will go on the website in due course, and I will circulate the slides as well and the leaflets that Krishna mentioned. But thank you very much for your time, sort of this late afternoon, evening, and have a good evening.
Thank you.
Thank you.
Thank
Bye.
you.
Yeah. Thanks,
Thank
everyone.
you. Bye.
Bye.
Bye.